learning to be a plastic surgeon. How does that work?
And I like to say I'm not just a plastic surgeon, I'm a plastic and reconstructive surgeon.
And so how have you seen the connection with the psychological benefits of people after you've done some type of cosmetic surgery?
I have seen so many women come in afterward, and to have them come back and they're in my office crying, saying, you changed my life. You gave me the ability to feel myself again. It's not about changing them into someone else. It's just helping them to feel more comfortable with who they are.
Hello, everyone, and welcome back to Talkin St. Pete. I am your host, Ryan Bogdan. Before we jump into today's amazing guest, I want to let you know that this podcast is sponsored by Bogdan Homes. So if you know anyone looking to buy, sell, or invest in real estate here in the greater Tampa Bay area, please find our contact information in the description below. And now on to our amazing guest. I am so honored and thrilled to dive into her world. We have Dr. Alicia Billington, the owner of Billington Plastic Surgery.
Thank you so much. I'm so excited to be here.
I'm so excited. I'm so excited. And thank you, Shelby, for making this happen, this introduction. Yes, appreciate you. And so congratulations, because I know you just now started bought your practice.
Yes.
Yes.
So I'm from St. Pete and moved back about, I guess it was a little over a year and a half ago, joined Dr. Robert Rinke, who is my mentor and the reason I went into plastic surgery, and just bought the practice 2 weeks ago. 2 weeks ago.
So by the time this comes out, the launch party would have been happening. We're cooking. We're ready to go.
Yep.
We're ready to go.
I've been practicing in the area for a while already, so I've already taken care of a ton of patients here, but I'm excited to meet even more people.
Yes, I'm excited. I'm excited to dive because I know this much about plastic surgery, other than a little bit of research that I've done prior to you coming on the show. So I'm excited to learn more about it as it's prevalent here. I think it's a thing that where everyone's taking care of themselves, doing all the things. But tell us, okay, a little bit of your background. So native to St. Pete, how did you end up in plastic surgery? Because I know you have an extensive background in terms of your education, having a dual degree in medicine and bio.
I'm impressed. You looked at my
biomedical engineering. Yes, yeah, but
yes.
It's a mouthful.
So that basically means I owe a lot of money to a lot of people.
But you also know a lot.
I'm supposed to, yes.
Yes.
So I really just love math and science. I'm a huge nerd. I just am one of those people. I love to sit down and play with numbers. I think it's fascinating. And so I knew I wanted to do something in science, but I also knew I loved working with my hands, and that sort of led me down the path of surgery. So I made the decision to kind of do both and figure it out. And I still use my engineering degree all the time, actually. I still do research, but I love being in the operating room. So I kind of like wearing both hats.
Oh, okay. So take us back. How did you end up there with going after that and understanding that this was a route that you wanted to go? So you like the math, numbers.
Yep, I like the math and numbers. I think everyone kind of has like someone in their life that maybe guides them or helps them. And for me, there was a person named Lester Hartswick, who I call my uncle. He wasn't really my uncle, but he became like a second dad to me. And he had a childhood friend named Robert Rinke. And I talked to Uncle Lester, and he's like, you really should look at medicine. So I kind of started thinking about that. And I thought I was going to do orthopedic surgery. And he and Rinke just decided that was not going to happen secretly. And so they
had a path for you.
They decided I was going to do plastic surgery. And I was like, I didn't know anything about it. And I was like, I don't think that's for me. I don't think I want to do that. And I remember going into my first plastic surgery case. I went into Rob's office, and we had waivers because I was a student and everything. And I didn't know anything about the patient. And I remember walking into the operating room. And when you're operating, you just have the area you're operating on exposed. You can't see the patient's face or anything like that. And I thought we were operating on a male. And I found out we were doing a breast augmentation on a female. And it was really the first time that I understood what cosmetic surgery could do, how it could transform someone's life, give them more confidence, make them feel more, just like they could go out and do anything in the world. And I really loved that. And I think I also partly fell in love with Dr. Rinke as a surgeon. I thought that all surgeons were going to be nice and bubbly and, want to teach and kind. And then I found out that some surgeons are kind of tough. But
and which one was he?
So he was just the kind,
he was
the good one,
He was
right?
the good one, okay.
And so I just wanted to be him when I grew up. So it's hard to say, did I fall in love with plastic surgery first, or did I fall in love with like this person that just was the epitome of who I wanted to be as a physician.
Okay.
But it kind of went hand in hand.
Yes, it sounds like it. They dovetailed together
Yes.
and led you down this path. But you didn't, I mean, you went to do extensive research in terms of the education that you pursued. So where did that?
Well, I just feel like when you're going through, and this is so hard, right? Because you have to figure out what you want to do the rest of your life when you're in college. And sometimes you haven't even seen any of it yet. So I just decided throughout my educational career, I was going to study things that made me happy and that brought me joy, and that I would figure it out. And so I knew I loved engineering. I knew I probably wanted to become a doctor, but I figured I would just take the path that worked for me. It definitely made it a lot harder. It was a lot more of a struggle going through engineering to get into medicine, but I think it worked out okay in the long run.
Yeah. So you mentioned that you still use your engineering background. How so?
So I still do a lot of research. I work on papers. I work with students. I actually was at East Tennessee State University, which was, oh my gosh, just a phenomenal job before I came back to Florida. And so 2 nights ago, I was teaching on misinformation in medicine. So I love to look at statistics and figure out, is this paper really accurate? Are there things that they're spinning? Got really involved with things with COVID as well, looking at data. So that's just a kind of a side passion of mine.
Just a little side.
Probably annoys all my family members.
You're diving in deep into the papers and everything else. Okay. So in plastics, native to Florida, what do you find? Because I don't know anything about plastics. So what is what are the common procedures? Why are people coming to you? And there's let's start there.
Yeah. What do I do? What is
Yes.
this plastic surgery stuff?
Yes.
So I think a lot of people immediately go to nip tuck, but plastic surgery is an incredibly diverse field. And I like to say I'm not just a plastic surgeon, I'm a plastic and reconstructive surgeon. So what does that mean? It's head to toe. I do all kinds of different surgeries. There's the cosmetic side, which is mainly my practice now. Everything from eyelids, facelifts.
People get stuff done on their eyelids?
Oh, yeah.
See, I have no idea.
Actually, that's one of the top male procedures.
Eyelids? What's going on with the eyelids?
So as you get older, your eyelids get droopy, and it can be hard to see. And actually, it can even be approved by insurance if you're having peripheral vision changes. So that's one of the most common male procedures that I do is upper eyelids, called a blepharoplasty.
So what do? You cut some skin out? And
Yeah,
just
I make
it?
a little incision. I cut some skin off, sometimes some fat. I also do lower lids where, people can get saggy eyelids down here.
I'm
hollowness
so
as well.
fascinated right now. I had no idea.
And we can do it awake. You can
What?
yes.
Oh,
yes.
man.
So for both of those procedures, the patients they can get a little bit of sedation, but they're awake during the procedure
Just
and they're totally relaxed.
Chopping off the
Just chilling.
eyelids.
Yeah, just chopping them off.
Oh, man.
But we do a lot of that. I do a ton of breast surgery. That's probably my number one surgery. Lots of different types of breast surgery I do, with implants, without implants. I also do breast reconstruction. So that is something I am extremely passionate about.
Okay, tell me about that.
Patients that get breast cancer, women and men can get breast cancer, helping them to reconstruct the breast to feel a little bit more normal. It's a really big process to go through, and it's very scary. So I really have a soft spot for those patients because 1 in 8 women are going to get breast cancer in their lifetime, which is that's a lot of people that we know.
Get your mammograms.
Yes, get your mammograms. And actually, they've just changed the guidelines. So if you are 40 or above, you should get a mammogram. If you've had a history of breast cancer, you should do it 10 years. Or someone in your family has a history of breast cancer, you should get it 10 years earlier. So
starting at 30.
Correct.
Okay.
Or, if they had it at 30, starting at 20.
Oh, got it.
So it's from the date of the age of the family member. Yeah.
Okay, that's good to know. That's some
Yes.
new research dropping right there.
Yes, and ultrasounds for patients that have very dense breasts as well. So they've just changed. It was very confusing because there were so many different guidelines out there. But for my patients, if you're coming in to see me, 40 and up, you have to get a mammogram.
Okay, that's okay. Good to know.
Yeah.
Go get them smashed.
Yeah. So that's great. It actually is not very comfortable. I've had it done, even though I'm
Yeah.
not 40 yet. But I turned 40 this year. But it's not a very comfortable thing. But it's not terrible.
No.
But that's kind of like cosmetic side. Also do tummy tucks, liposuction. But then, I have lots of stories of plastic surgery of crazy stuff.
Yeah, like share some of those. Let's get into that.
Okay. Hippopotamus versus person. Burns.
Wait. Go. Because I have no idea what you just.
There's been various animals versus people, and they get traumas that we've taken care of. Tons of dog bites. Obviously, that's kind of like the thing I see most frequently, probably in the emergency department. Lots
Like
of
people with a dog bite on the face or
correct.
something like
Yes.
that. Yeah.
Typically, I get called for more of the facial trauma. Gunshot wounds to the face. Unfortunately, we see. It's just burns. People don't think of plastic surgery as burns.
Right.
Firework injuries. So the 4th of July is.
I saw that you put a video out about that. That's crazy.
Yes.
When I was watching you, I was like, "What? Oh, makes sense."
Yeah, you know how there's always like the fun uncle?
Yeah.
I'm the not cool aunt. So like there's
Extra safe.
there's a perimeter.
Yeah,
All the kids need to be back.
Yeah.
I know that
No one's holding the bottle rocket out of their
I
hand.
have to make up for it on every other holiday because I am not fun on the 4th of July. I'm just like, stand back. Where are they going?
Yeah.
Yes,
Well, I'm
yes.
sure if for some of the things that you've seen, it makes it really real for you that we cannot.
It is. I mean, I've seen people blow digits, fingers off. People do crazy stuff. All of the stories that start with "hold my beer," usually plastic surgery ends up on the flip side of that. So,
Oh no! If there's a camera out and it's a "hold my beer" statement, you're doomed.
yeah, right.
You're doomed.
Yeah, exactly right.
Oh no. Okay. So wide range of what's something that you weren't expecting from getting into the industry that you experienced.
Ooh. Well, I would say right now, being on the business end of things, that's something that totally wasn't prepared for in residency. So residency teaches you how to take care of the patient, but there's so much that goes on with the industry of plastic surgery that I've had to pick up on my own in the last year. And I've been very fortunate to have some great friends and mentors. And actually, I just talked to Dr. Chitty, who's this amazing plastic surgeon out in Utah. And, you meet these people that just open up and help you and tell you things about their practice. And so I've really enjoyed that. I think that kind of collaboration I didn't really expect because you think, it's going to be kind of cutthroat. But there's been a lot of people that have really helped me. So.
That's really cool. It's good that there's a community there. That's one thing I've learned from doing this show is how many micro communities there are, whether it's within an industry, just here local to St. Pete. I mean, everyone has their tribe of people.
That's very true.
And it's really fascinating because then the wealth of knowledge that's being spread within that tribe is awesome.
Yes.
Right? And then we get to share it here and talk about it. That's really, really cool. I had this question and so I want to.
Uh-oh. It's typed up and prepared.
Yeah. Well, it's because you talked about a lot doing cosmetic things. Right. And so how have you seen the connection with the psychological benefits for the good or for the worse of people after you've done some type of cosmetic surgery?
The first time I meet a patient, the majority of my consult is probably more on getting to know them and figuring out what their goals are. Because if I have someone that come in that has unrealistic goals or wants something that I am not capable of doing for them, and I do surgery on them, we're both going to be unhappy. So I think it's really important to figure that out beforehand and spend a lot of time getting to know the patient. So if I have concerns about that, then I'm not going to operate. And I say no. And people are, shocked that
How often do you have to say no?
Not often. I would say, maybe once a month or a couple times a month. But they usually say at the end of it, they usually say thank you and understand where I'm going. And I do in a very kind way. And I explain it because I don't want them to be unhappy. That's the whole reason that they're here. But I would say I have seen so many women come in afterwards, especially women that have had children. And I always say, you've kind of donated your body to your kids because there's a lot of changes that take place. And for a lot of women, they won't put on a bikini anymore. They won't wear a swimsuit. Some people will not wear short sleeve shirts because they are uncomfortable with their arms, or they won't let anyone take photos of them. And to have them come back and they're in my office crying, saying, you changed my life. You gave me the ability to feel myself again. It's not about changing them into someone else. It's just helping them to feel more comfortable with who they are. That has been really cool.
That's very rewarding, I'm sure.
Very rewarding.
Because you're changing people's lives and the confidence of your image is huge.
That's right.
I mean, especially for some more than others, but all of us care at some level.
We do. I mean, some people argue, well, plastic surgery is terrible because you're altering yourself. But I'm like, did you brush your hair today? Did you brush your teeth today? Did you pick out which shirt you were wearing? Did you get new shoes? Did you put makeup on? All of these things that we do are really not for us. They're for outward appearance and other people, right? So I think plastic surgery is a part of that. And that's kind of how I look at it.
How has the industry evolved with the materials that are used and things like that? Because there's it floats around out there. Well, they're toxic, can be bad. Implants can get moldy.
Yes. There's a lot of really great information and a lot of misinformation. And so I spend a long time in clinic going over for someone that's there for a breast consult, breast implants. So there's something called breast implant associated illness. And what I explain to patients is it's not an ICD-10 diagnosis, meaning if you go to bill for insurance and you go to the drop-down menu of all of the things you can bill for, it's not going to be there, meaning they don't quote unquote recognize it. But we are required by law now. Recently, there were some rules that passed on implants with the box labeling. We have to tell them about it. So that's kind of like this weird, like, is it or isn't it real kind of thing. I believe my patients. If they come in, they say, I'm having all of these symptoms. I have a lot of autoimmune things going on. I've gone to a bunch of doctors. I don't know what it is. I want my implants out. I'm happy to take them out. I say, hey, we should be very thoughtful about not putting them back in. And if we do, we really need to talk about it. What I think is going on is for a lot of patients that have breast implants and are having back pain, headaches, things like that, for some people, I think there might be some stress on the fascia, on the muscle, that's causing them to kind of hunch over more. It's a little bit more weight. And the reason I say that is my breast reduction patients, they kind of have relief. This weight is lifted, and they kept telling me I can breathe better. And that didn't make any sense to me until I saw one of them go, I can do this. And she kind of opened up her shoulder blades because she didn't have the weight there. So I think there may be a component of that going on. But implants have changed so much. So there's saline and silicone implants. And the old silicone ones, if you cut a hole in them, they would kind of spill everyone. The newer ones are more form stable. So, there's a lot of advancements that have happened with implants over the years. However, we're still using implants. So there's a lot of new things, new technology that we're using with fat grafting, with mesh. And I think we're going to eventually one day see a lot more of that taking place as well.
Okay, explain that. What's that? How is that different than what's currently happening?
So what's cool about some of these other modalities like fat grafting is you can take fat from one part of someone's body and transfer it to another. So you do it through liposuction. So you make small cannula incision holes, stick something in smaller than a pencil, suck fat out, and then you put it in a syringe and inject it where you want to go. Now, it sounds like, well, why don't I do that everywhere, right? You have to have a good blood supply. So if you put too much fat in, it's going to die. So you have to be mindful about those sorts of things. But what that's really great for, particularly, is breast cancer patients who've had radiation. It can help with some wound healing things as well because of the stem cells that are in the fat.
Okay, that's interesting. And you also have to have fat to take.
We can usually find fat somewhere, but yes, some people, you're right, have very low fat volumes, and so that does make it challenging.
Right. Do you do? And this is this might be a funny question.
I'm ready.
but I've heard about this Brazilian butt lift.
Yes.
What's going on with that?
Okay, so Brazilian butt lifts. So that's where you take fat from one area of the body and you inject it into the buttock area to give a fuller buttock. I do not do it. And the reason why, there's a risk of 1 in 3,000 women that get this procedure can die from it. And those numbers, probably aren't exact either because a lot of people are lying about it. But what we're seeing is that if you inject the fat in that area, there's a lot of really big veins, and it's kind of a negative pressure system. And what happens is the fat can get sucked in and you can get a fat embolism. And really, there's no treatment for that, and you can die. And so there's been a lot of really big deaths in the news over that, particularly in Florida. So for me, I've got so many other great surgeries I can do.
Yeah, we got to avoid that one.
It's not worth the risk for me, but I respect people that do it. In Florida now, you have to do it under an ultrasound. So you have to be able to visualize where you are. But it's just never been a big part of my practice. And when I started seeing that come out, I just said it wasn't for me.
I don't blame you. I have seen a horrid picture of it not even like being sewn all the way shut.
Correct.
That's why I had to ask, because that image is scarred in my mind. I wish whoever showed that to me did not.
It's also a trend, though, that's going away, right? Kim Kardashian kind of started it off, but then she kind of all of a sudden didn't have it anymore. So did she have it reversed with liposuction? So
because you used to be able to sit this couple in there.
Yep, that's right. So it's a lot less people are coming in asking for it as well. And you see trends in plastic surgery.
Yeah, of course. Yeah. Okay. Well, that's good to know that we cleared the air on the.
I'm sorry, but I cannot offer you a Brazilian butt lift if that's where we were going with
Dang
this.
It. No. Okay. What about Botox?
Botox. Love Botox.
Tell me about that.
It's like this miracle drug. I love it. And what's really cool about Botox is it only lasts for 3 to 4 months. So if you do it and you don't like it, it's gone. That's also kind of the downside, right? Like I wish you could get it and leave it forever. But what it does is it helps to prevent what we call rhytids or wrinkles in your face. So mine is loaded up in this area right here because I turned 40 this year. So I have some smile lines. And it's a neuromodulator, so it binds to a receptor and it lasts for a period of time. What we've seen is it's very safe. There are some questions about whether or not it can be used in pregnancy and breastfeeding, and currently the recommendation is no because we don't have any studies on that. It's kind of hard to enroll, pregnant women in those sorts of studies. But so it's not recommended for those women, but we also use it for a lot of other things like bladder spasms, dystonia, people that get migraines, and lots of men are getting Botox. We call it Brotox.
Brotox. Getting the Brotox.
Yes, I have a large amount of men that come in to my practice and get Botox.
That's interesting. I'm still trying to figure out how I feel about that.
I mean, there's only one way to find out, right?
Right. This is true. Okay, so I want to know like a bizarre story, or like maybe not bizarre, but like maybe the most, whatever you can share as a story that really sticks out to you from a procedure that you did, or something that was just you had no idea you would ever be doing that type of thing. Because I feel like you come across unique things all the time.
We've had just so many incredible patients and incredible experiences. And, I don't want to violate HIPAA, so I'm trying to think of things that are fair to share.
Yeah.
I would say, people have maybe had a little bit too much to drink and done things that they shouldn't have done and had some injuries. But I've definitely had a couple of patients that have really touched my life. One is a young breast cancer patient. She's a mom, and she has several little boys, and she had to get a bilateral mastectomy, so both breasts were taken off. And I did a surgery where I took her belly tissue, and I made breasts out of it. So it's called a tram flap, and you can take...
This is an art.
That's probably the coolest thing I remember, like the first time I saw that surgery. It's like, how did that happen?
Yeah. Okay, keep going. I'm intrigued.
So it's a long surgery, and I did that. And when I looked at her after pictures, I mean, if she's wearing clothes, like you can't tell that she had cancer.
Wow.
And that was really cool. But she was younger than I am. And that really hit me because I was a new mom at the time when I operated on her. And so, you have stories like that. You also have patients that you lose, that pass away eventually from their disease process, and that's really hard too. I remember my first patient death. I remember the first person I did CPR on, and they make you better doctors, but it's really hard. So definitely my patients have taught me a lot.
I bet. I mean, it's not easy.
Yep.
And you build bonds with these people and help them through, and then, I mean, it's inevitable, full circle. Yeah.
I have a couple that still send me Christmas cards or texts, and that's kind of cool too.
Yeah, that is. It is. That's you touch people's lives in a special way, and they'll remember you forever.
It's a huge honor.
Yeah, it's recently there's been some death in my family, and we talk about what's the impact.
I'm
right.
Sorry to hear that.
Yeah, it's okay. But what's the impact that you have while you're here, right? Because that's really what matters. How many people can you touch and they're going to remember you, and so it's important for all of us to take those moments and practice gratitude and be here now. And
very much so. And, I see not as much anymore, right? Because I'm in cosmetic surgery now. When I was a resident, we had lots of traumas coming in. But when it happens to your family, it's so different. When I had my daughter, she came home from the hospital, so she's newborn, and my husband went out to the grocery store. So it was the first time I was alone with her, right? Because I'd been in the hospital, now we're home. And she started choking and went blue and stopped breathing. And my immediate reaction was to run and grab my cell phone, and I was about to dial 911. And then I went, I am 911. Like I got to do it. Before, she's going to die before they get here. And she was fine. She immediately started breathing, and I'm sobbing, calling every pediatrician until one of my friends picks up, and I'm like, she's not breathing. They're like, we hear her crying. Yeah. But what it taught me was in that moment, you go into mom mode, And it doesn't matter like how many people you've worked on in the hospital. When it's your family,
Right,
it hits different.
Right. Yeah, it's close to home.
Yeah.
Panic a
Yeah.
little. Yeah.
So you gotta like put that aside.
Yes. That's that. I can see that. I can see how that happened, and luckily everything worked out. And yeah.
My husband would say though that does not happen at all. Like when it's him, I'm like, you're fine. You're fine.
Yeah. Shake it off. Yeah.
You'll be
It's,
okay.
yeah.
You have another leg.
So learning to be a plastic surgeon, how does that work? Like, what was the first time? I mean, you said your first surgery, but I mean, getting up to that point.
Sure. So you kind of have to start early figuring out what you want to do, which is so hard for kids because you haven't seen the world yet. But I remember in high school, that's kind of when I figured out, okay, I'm probably going to want to do this. I'm probably going to have to go to a good school, get good grades, and figure all that out. So you have to take courses, pre-medical courses that are required to get in undergrad.
Mm-hmm.
And then you have to go to medical school. So getting into med school is really hard. And you have to take an MCAT exam to kind of assess, like, if you can, do well in, I think, gosh, it's changed, but it's like English, I don't know, science, biology. So and organic chemistry. I remember that was definitely on there. So you have to take all these classes. Med school is typically 4 years long. The first 2 years are kind of more book work. The last 2 years are kind of more clinical. And then you figure out, okay, what type of doctor do I want to be? And you apply for something called the match to get into residency.
Which is like the NFL draft for the doctors.
Yes, or sorority match. Rush,
Yeah.
yes. I actually think they use the same algorithm.
Really?
I'm like convinced.
I've had some friends that were going for residency, and they're explaining this process to me. I'm like, that sounds absolutely crazy.
Yeah, it's terrifying. So on Monday, you find out, did you match? Now, for a lot of people that are going to something like plastic surgery, you might want to also try to match into general surgery because it might be a little bit easier to get in. And then you can try to do a fellowship. So I suicided. So on Monday, I didn't care. I was like, I know I'm a plastic surgeon. I don't know where in the country I'm going. But for some people, they knew they were going to be some sort of surgeon. They didn't know if it was general surgery or plastic surgery. But I call it Magical or Miracle Monday because that was like I have a picture. It was like the best day in my life when I found
Getting
out.
that.
Yeah. So that was amazing. And then on that Friday, you find out where you're going to go for the next, for me, it was 6 years.
Wow.
Yeah.
The residency process is great. So I used to live in Philadelphia, which is just filled with residents everywhere, from Jefferson and John Hopkins. I mean, all the hospitals are there. So surrounded by residences and here them going through. I mean, it's
a lot.
Hats off to you guys for doing it, for sure. Yeah, we need you. And
no one did it alone.
No.
Okay, like for every resident, there is a whole crew. I did not. My diploma should have a lot of people's names on it. I had a huge support system.
I believe that. You did some type of internship with NASA, no?
Yes, I did.
Tell me about that.
Wow,
That's pretty cool.
You really dug through my.
Yeah.
It was on fruit flies. Actually. Yeah. So,
fruit flies.
Yeah. So I wanted to be an astronaut. Like that was life goals.
Yeah.
And so this was like back before we really even had a computer. I think I logged onto my grandmother's computer, who played solitaire, and I was like, oh, there's this NASA thing. And so I applied. There were 20 programs in the United States. I somehow got selected. They flew me up to Cornell, paid for me to do research for a summer, and I just did research on fruit fly genes and was like, this is pretty cool.
What did you find out about the fruit fly?
You know what? I don't remember.
Okay, it wasn't anything crazy.
I don't know. But we were looking at genes, and it was really cool because you get to learn how to run DNA, and I learned a lot about that process, like the process of being in the lab and doing research. And
that's cool.
I knew you were going to ask me what I learned, and I was like, this is not going to end well for me.
That's okay. It was a bit ago, and it was a fruit fly, so I think it's okay.
Yeah.
All right. Well, when I saw that, I was like, oh, well, that's an interesting fact.
Yeah,
and
man, that was a long time ago.
Yeah. So okay, so you traveled all around the country doing your education. Back here now, helping people out. What are I think you told me to ask this, maybe, right?
Uh-oh.
Kinds of rare forms of cancer from implants.
Rare forms of cancer from implants. So kind of talking about people being concerned about breast implant associated illness.
Yep.
So there is something called anaplastic large cell lymphoma. So I do tell all patients about that. There's two different types of implants, saline and silicone, but the outer part of the implant can either be smooth or textured, so kind of like just rougher on the outside. And what we found was that for a small subset of people that had these textured implants, they were getting this really random, weird lymphoma. And it was behaving in a way that the lymphoma didn't typically behave, which actually ended up being a good thing. It was more treatable. If you removed the capsule and the breast implant, you got better, which is like pretty cool.
Okay.
But so about 1 in 3,000, again, women that have this type of implant can get anaplastic large cell lymphoma. So I do not use them in my practice. I do not even use textured tissue expanders, which we use in breast reconstruction sometime, which is a water balloon that kind of blows up to stretch the skin, and then we switch it out for an implant. There are a couple of reported cases, really rare, like 15 ever in the world. So this is like really, really rare, of squamous cell carcinoma and some other rare lymphomas that we've seen. So I tell all my patients about it. The thing is, I prescribe Tylenol every day, and Tylenol kills a lot more people, right? So this is kind of where statistics is important. You have to weigh risks and benefits. So 15 reported people ever. Okay, we'll continue to monitor it, but extremely low risk. So for all my patients, I use smooth implants.
Smooth. Okay. The texture, I mean, as you're saying that, makes sense because it's more for things to grab onto.
Yeah, and actually that's why I think it happens. So you're genius. That's a really great observation.
I mean, it just makes sense, right? You have to texture a wall before you can stick a brick to it.
That's right. Yeah. And that's why they made them. That's why a lot of people like textured implants, because your tissue would kind of grow into it and it would prevent the implant from flipping. Because especially if you have a shaped implant that's not perfectly round, you don't want that thing moving around, right? Because it would look funny.
Yeah.
So, but what I think's happening is it's causing micro tears. So it grows into it more, and then, maybe you move and it tears. And what we know for sure in medicine is that if you have wounds, you have an increased chance of getting certain types of cancer in those wounds, just because it's, there's cellular turnover. And I think that cascade has more opportunities to make an error. So I think that probably, this is my theory.
Yeah. I'm
why
following along.
I think that's what's happening.
It makes sense.
Yeah.
In theory, makes sense.
I don't know how to prove that. But
right.
Somebody's gonna steal this idea though, and we could have written it up together.
We could have written the paper. Yeah.
Bogdan and Billington.
Yeah. taking over the cancer research for implants. That's interesting and good to know. I mean, that there is, but it sounds like it's rare and you're not using it. So it's not.
It is. And there's risks with everything that we do in life. I mean, even if you come in and you have a mole removed, you could have a reaction to something, if you take an antibiotic. So I always tell people about the risks and benefits, and then we figure out as a team if it's right for
risk
you.
Reward. And I'm all about statistics. I like to jump out of airplanes for fun. And to me, driving a car is more risky than doing that.
I've never jumped out of an airplane.
You should.
Where do you go?
Zephyr's Hills, Skydive City.
Okay.
Z Hills.
I hope my mom isn't watching this podcast.
If you want to go, I'm so there.
I will do it.
Yeah, I'm so there. You'll be attached to someone else, but you can watch me.
I might have to put a Foley in because I might pee myself.
Yeah, no, it'd be great.
Let's do it.
Yes.
Okay.
There's this awesome, so when I do classes or trainings at my office, I'm teaching, I show this video all the time. It's Will Smith talking about his skydive experience. It's like a 3-minute video.
Okay.
But pretty much at the end, he says that the greatest things in life, that God placed them on the other side of fear. And that when you jump out of that plane, all the fear is built up to that moment. But the minute you go out the door, all the fear is gone.
Oh, so cool. That sounds like a release.
And it's this blissful moment. And it is, because everyone thinks that there's going to be this drop, but there's not. It's kind of more like jumping on a big squishy slide.
Okay. Because
the plane's moving, like say 100 miles an hour, so you had the relative wind
drag,
hitting you, and then you start to just fall down. So you're kind of jumping on what they call it the hill, jumping on a hill.
So do you ever do the thing where you go straight down to make everything smaller so you go faster?
Yeah, of course.
Oh, wow.
Yeah. But when you're in tandem, you're so discombobulated because it's nothing that
How many of
you
these have you done?
49.
Oh, so 50's coming up.
50's coming
What are you
up.
doing at 50?
50 is like when you get to your next license level.
But are you celebrating? Are you having a party? This is a big deal.
Maybe it's really not.
It is.
It
I've done
sounds
this
like
many.
it, but in the community, like another community of skydiving, I'm a baby.
Wow.
Yeah.
So I'm like a cell.
Yeah. Yes. To bring it to metal, you might even just be not even just the egg in the sperm. You're not even like.
All right. Well, I'm down. Let's do it.
All right. Well, you heard it. It's on. It's recorded. We have video and audio proof.
Okay, I'm gonna do it. I'm really sweating now.
I love it.
These lights on?
Well, yeah. So you'll explore a different part of your area from the sky.
That sounds cool.
It is cool.
Okay, I'm really.
Where'd your husband go?
I don't like know if I want him to go at the same time
No,
because I have a daughter, and I'm
yeah.
like, what if we both die? Like,
Well,
what if the plane crashes?
Okay.
I know the plane thing. I'm doing statistics. Probably not.
You
gonna
have a
happen.
parachute.
Okay, I will ask him. I don't know. I don't know if he'd do it.
You make sure the life insurance is paid up and you're good.
Oh my gosh. Okay, check that.
Yeah.
Okay, well I'll do it.
Yeah.
I'll talk to Josh and see if he's down.
Okay, fun.
Yeah.
That will bring me lots of joy. You'll be the first podcast guest to go skydiving.
Okay, well then I gotta do it.
Yeah.
All right.
So tell me about St. Pete. You're born here.
Yep.
And it's changed a lot.
Yeah. So when I was younger, I remember being in high school thinking, I'm getting out. I need to get out and do the world. I'm going to move to New York. I am not very good with geography. So I thought that when I went to Cornell, that was like right next to New York City. And it's not. New York's really big state.
Yep.
So I went and I loved it. And I've actually lived all over. I've lived, New York, Boston, Shreveport, Louisiana, Canada, outside Philly, DC, Tennessee, where I lived for a year. So I've lived in all these places, and family is really important, and I love my family so much, and being back here with them is incredible. But also, like, this is a community that is a family too. It's so unlike any other place I've ever lived, and I've seen it change a lot, but I've also seen it stay the same. And people are kind of freaked out. Oh, more people are moving here, and what I'm seeing is they're not changing the culture of St. Pete. They're just more people. So I think that's kind of unique, is that the culture of St. Pete has been able to transcend all of these changes it's going through. There's way better restaurants. There's way better cool things to do, but it's also beautiful, and that hasn't changed. So that's what I love about St. Pete.
I love that you said that, because no one else has articulated that, in that even with the more people, that culture hasn't changed. And the people make the culture, right? But the people that are attracted and coming here is because they like the culture and they are adding to it.
I think so. I think it rubs off on them.
I think so. There's something, we talk about almost every, but it's something special. And those that are coming here keep that in the amber of St. Pete. It's not going away. And even just on the last episode, we were talking about, keeping St. Pete local and downtown, and with the development that's happening, will big retailers slide in, and hopefully there's local regulation that keeps that from happening.
Hey, I think that's not a bad thing, though. I think we need both. I mean, I think we need both a little bit big and small, because there's some things that bigger companies bring that are beneficial. However, I think we don't want to have chain restaurants on every street. So I don't think that's going to change, because we won't accept it. We won't go there.
Right.
I mean,
no, we won't.
Like, that's just not what St. Pete's about. So I think that there'll be like a little figuring that out. But I also think, the culture of St. Pete is such that we want to keep it a community. So
it is. Even from just doing this show, this person knows this person, and I didn't even know that they knew each other. But it's wild.
Yeah,
it's really
well,
really cool.
My mom was a teacher. My dad was a police officer. So people come in all the time, and I'm like, I always hope they know my mom, because I'm like, oh, my dad didn't arrest you. I'm just kidding. But it is incredible, like, how many people my mom have taught, and somebody knows somebody, and we end up talking for like the first 5 minutes about like how we know each other, but we didn't even know we knew each other.
That's cool.
It is cool.
That is really cool. What do you think St. Pete's missing?
Parking. I think it's missing a plastic surgeon, which is why I'm here.
Yeah.
Gosh, I think it's got like really great restaurants, which is so important to me. I'm like a big food person. I think it's got a good bar scene. I think it's got a lot of great outdoor stuff. One of the things that I'm really excited about that I kind of thought was missing is, I spent a lot of time in Tampa. I did my residency there. So I love both cities. But we didn't have like a strong collaboration amongst all of the aesthetic industry here. So Lauren Settle, who's a nurse practitioner in the area, we teamed up to create an aesthetic society. So that's kind of something that we...
Tell me about that. I did see that you were doing
Yeah,
that.
It's really cool. So we have, what did she say?
She found out about that. She told me, yeah.
We have doctors, nurse practitioners, PAs, estheticians that kind of all come together. And it's a community where we can all learn. And we didn't have that before. Everyone was kind of like maybe going over the bridge to Tampa, or just like not collaborating at all. And we had our first meeting, and it was so cool, because you see all these people that are supposed to be competitors with each other coming and sharing ideas and saying, hey, can we talk about this? Or if I have a problem, can I call you? Or I have a tough case. So I think that was really neat. So that's kind of something that I saw was like maybe, something we didn't have here.
But you made it.
But we're making it. Yeah, we're growing it. But otherwise, I think parking is it's always an issue in every city. And I know they're working on transportation and things like that, but it's not bad. I mean, I've lived everywhere and we're pretty lucky.
When people say parking, I'm like, I came from Philadelphia, New York. I mean, there's a parking problem.
Yeah.
You can't find parking
You can't
ever.
do it at all, right?
Right. Here, it just depends. If it's a Friday, Saturday, depending where, of course, it's going to be a little busier. But Tuesday afternoon, you have no problem.
And with Uber now, it's like, it's just,
You
it's not a problem.
Not a problem.
No.
Not a problem. As you were saying that, the community that you're creating, I think one misconception is that there's a limited mindset on the amount of business that there is. And like to the point you're saying about competitors is there's enough business for everyone.
Yeah. I mean, there's so many people moving here. And so absolutely. And I think if you work really hard, you make connections, you give out a good product, that's kind of what brings people in. So a lot of my patients now are referrals from other patients because I've been here long enough. And, initially it was like, okay, someone called in or I knew someone from growing up, but now it's like a patient of a patient of a patient. And I think like that's the takeaway, that if you come here, you work hard, you're going to succeed. St. Pete's a really awesome place to work.
I believe that. The community is strong. They'll support you. You have a good product. You have a good vision. You're a good person. Mm-hmm. People want to help you succeed. Yeah. Doesn't even matter if it's a competing industry.
And you got to give back, though. Yeah. Like, it's not just about taking. So I think it's really important to give back to the community, and our practice really tries to do that. But, there's so many great organizations in the area, just really cool stuff people are doing, helping other people. That's another thing that really sets us apart, I think, is if someone asks for help, it's always yes. Like, or I can't do it this way, can I do it that way? Which is kind of cool too.
Yeah. What are some, now that you have the practice or just being in business, right? Because you talked about that a little bit, like you learn all the medical stuff, getting into business. What are some struggles that you've had as like being a business owner?
Yeah, so I never took a business class in my life. Nothing.
Which is fascinating because as doctors, you most end up.
We're so dumb. We are so dumb. And doctors think they know everything about everything. So that's like...
yes and no. You're very intelligent human beings, right? In your area.
In our area, yeah.
It does not mean everything.
There's a lot of other areas besides medicine, though. So the hardest thing for me has been figuring out how to juggle, because really, taking care of patients has become the easiest part of my job. There's just so much to learn about accounting and, I remember, this is really embarrassing. This is how bad it is. I went to the bank and I had like all of these cards, and I'm like, okay, one of them's a credit card, one of them's a debit card.
Oh no!
And I'm like, this could go one of two ways.
What?
Like that's where we started with my business acumen, and so I've grown a ton, and it's been fun. It's been cool using a different part of my brain. I've enjoyed it, but the social media is like
so big.
Are you
doing that?
Yes.
Oh,
but I have people in my office now who are incredible and so talented, and they are doing it. And
you're doing the right things.
I am so thankful for them. Becca is like, and Lucy in my office like are killer. They're just so good, and they're really cool with my crazy Taylor Swift ideas. I'm like, I got an idea, guys.
Taylor Swift ideas, meaning what? Like you just...
there's been a lot of Taylor Swift on my social. My husband says a little bit too much, so I'm like maybe backing off a minute. We do a lot of videos.
Got it. And including the color pink.
I do like the color pink. Yes, I'm a big fan of pink. And is this like safe space?
Yes.
Like we're in a circle?
I mean, we're recording.
Okay, so this is coming out after the launch.
Yes.
So I can tell you.
Yes, you can. Yes.
I know we had some guesses. Pink.
Yes.
It's actually not pink.
It's not.
It's not. It's blue.
It's blue.
We went with
No
blue.
one knows what we're talking about right now.
No.
That's okay.
Our new branding, our new logo is coming out tomorrow.
Blue.
At our launch party, and we went with several different
So
blues.
we're pre-recording this.
Yes.
You won't be hearing this
You
for
are
weeks.
the only human being that knows this. My parents don't even know.
Oh my gosh.
Yeah. Actually,
this is
they may.
Safe space.
They may. I think I may should.
Okay, blue. I like blue. It's my favorite color.
You got blue on.
It's my favorite color.
It's actually my husband's favorite color too. So.
But it's inviting. It's
Well, 10% of plastic surgery patients are male. So I didn't want. I am pink. If you go on, like everything is pink.
Right,
but I wanted.
Pink,
I wanted it to be welcome
might
to
not
everybody.
be walking in there for the Botox.
Right. So I wanted it to be Ryan accessible. I knew you were gonna ask this question, and before I left, my staff was like, "Did you see his pot?" I'm like, "Of course, I watched all of them." Okay, so I'm sorry, I have to do it. I'm gonna be really bad. Okay,
Why?
So favorite hamburger place.
Oh no, this is great. I love this.
Ted Peters. Have you been there for?
No. Okay.
It's the best hamburger place. My aunt works
this?
there.
Where's-
It's on the way to the beach.
Okay.
So they're like really big. They have to actually special order the buns.
It's Ted. What is it called?
It's Ted Peters. It's like
Ted
a fish
Peters.
place.
Okay.
But they have the best burgers.
Okay.
So it's just get like a cheeseburger. It's this burger bun cheese. It's
That's how I love it.
It's like the best.
Yes.
So for breakfast, I know Shelby told them on your podcast, pineapple espresso. I was literally there today. It's becoming a problem. I try to change my hair so they don't know
don't know it's me.
They don't know it's me. They're like, hi again.
Yeah.
So that is amazing. The egg sandwich there is like my jam. Dinner, Urban Stillhouse is super cool.
I haven't gone there yet.
Oh,
I don't know why.
it's really good. Really good drinks.
Yeah.
Yeah.
I need to
We
go.
had our Christmas party there. It was really good.
I've heard great things. Birthday's at the end of the month. I think I'm going to go there for that.
Yeah, get reservations well in advance.
Yep.
It's phenomenal.
Remind me
Yeah.
to make sure that happens.
It's good. And then lunch. Okay. I always say the name wrong, and they said it to me before I walked out of the door. Casita Taqueria. I say Casita Taqueria. They're like,
Yeah.
that. We're not.
Yeah.
Yeah, that's not a place. Oh my gosh, they have a enchilada soup, which I would never get soup at a taco place. It is the best thing ever. It's like queso with a spoon,
That's
so
the
it's
gas station
it kind
place,
of
right?
makes it accessible. Yeah.
Yeah.
Yeah, so there's
That's
one
how I know it.
There's a couple of different ones. There's one off of 66, though. That's where we do a bunch of our lunches at our practice.
You came prepared.
No, I just like to eat a lot. And I was very stressed about picking one, so I thought I would do it in breakfast, lunch, dinner, and hamburger because everyone needs a hamburger in their life.
Everyone needs a hamburger breakfast. Okay. And what about Well, you getting coffee at the Pineapple Espresso?
Okay, I don't drink coffee.
Okay. Well.
I just don't like it. It makes me sick.
Well, then fair enough. Well, don't
but
drink it.
I get the purple drink. There's
Okay.
I don't and I is it
Matcha. Yes.
There's purple. I just say purple drink, and then it appears.
Then
And I
they
say,
know.
and you made it. They made it sweet for me one time. I literally don't know what I'm drinking, and I just keep going in and saying the same thing, and they keep handing it to me.
Here's the
There
purple
might
drink.
not even be matcha in it. I don't know. It's just purple, but it's really good.
Yeah, matcha is a green tea leaf ground up
Okay.
into powder.
So what makes it purple?
Ube? Yeah, it could be. I don't know. We're gonna have to figure out
I
what's
don't
in
even
your
know how
purple
to
drink.
spell these things. Okay, I'm gonna get one tomorrow, but I didn't get one today.
Okay.
I missed out on
Maybe you need to ask what's in it.
it.
You can
You're
report back.
Here's some motor oil. It tastes great.
It's fantastic. Yeah.
Yeah, the
Yeah.
purple drink. I drink the pink drink at Starbucks and the purple drink at Pineapple Espresso.
Hey, you get it. You like it. It tastes good.
It's good.
All right. No worries there. Okay. What do you like to do with your daughter?
She's so much fun. She's just turning 3 in a couple weeks. So we like to cook. We like to bake. She likes to make macaroni and cheese. She's phenomenal at it. She is great at making brownies.
Oh, that's cool.
She's clean. We wash her hands first. Don't worry, in case anyone ever has eaten anything I brought into work. She likes to go running with me, so I bring her running in the stroller
Oh, that's
sometimes.
great.
That's pretty fun. We do lots of arts and crafts. So I would say 1 or 2 nights a week we're getting stuff from Target where you can take popsicle sticks and make stuff.
That's great.
We make bracelets together. Yesterday we went to the new Little Word
I
Project
noticed
store.
you got those on in your
Yeah.
necklace. Yeah.
So she's into that too. So
Where do you go running?
on Bayshore. That's and then also when I did cross country, we used to go down on the water here. But I love the Bayshore run. That's probably one of my favorites. It's just out back. You see dolphins all the time. So anywhere that's near the water, I'd like to run. I haven't run on the beach in a while. It's kind of bad for your shins, but
Yeah. And
Yeah.
you're always kind of crooked.
yeah.
Yeah.
I guess you can turn around and go back the other way.
Right.
but
And let you level out. Yeah. That's the hip thing.
Yeah.
Yeah.
That's what I look like running too.
Yeah.
Yeah, but I'll run anywhere. I just it's such a important release.
Is that how you
Yeah.
ground yourself?
That's how I problem solve, is when I'm really stressed out. Sometimes like Josh will just be like, I think you should go for a run today. It's really nice out. That's his way of saying, oh my gosh, you need to go figure some stuff out. Like, go for the run. And then I come back and I'm like, oh yeah, I'm going to do this and that. And I got it all planned
Okay,
out.
so you're thinking while you're...
Oh yeah. That is my happy place besides the OR. Like, that's my...
Yeah, what's that? So back to that for a second. What's the longest you've been in the room, gloved up?
When I was in residency, we had like cases that went, I remember one was like 15 hours. I mean, I like stopped and went to the bathroom, I think once or twice.
Did you eat?
I stopped and went to the bathroom once or twice and like had like some crackers. It was a lot, but like
the adrenaline, I guess, is keeping you.
When you're in residency, like you go. Like, you had breakfast in the morning, and then we just went.
Wow, you have to be exhausted after that.
Yeah. But the surgeries are really cool.
So what type of surgery is going for 15 hours?
That one was a free flap. So I told you about
free flap.
I told you about like where you can take the belly tissue and make breast. So sometimes with surgeries that we do, you always have to have a blood supply. If you don't have a blood supply, things won't live. So sometimes we actually have to sew blood vessels together to keep the area of the body that we're moving alive. And so on that surgery, we were doing a free flap where we were taking tissue and connecting it to the chest. You have to take part of a rib out. It's a really big surgery, and sometimes it's not easy, and sometimes getting
You're so casual about just take a rib out, do this, connect some things. It's like, okay,
it's cool. I mean, it's the coolest job in the world. I think I love it. It's really fun. But yeah, I mean, that was probably one of the longest ones.
What's the typical like when you're doing implants and things like that? How's that long?
So, they can be anywhere from an hour and a half to some of my surgeries are 6 hours.
Really?
Yeah. Okay. If I'm doing a lot of different stuff, a mommy makeover, or I'm like doing a reconstruction where, I'm getting fat grafting and lots of different things going on. Facelifts can be up to 6 hours and around there.
Wow.
So.
Wow.
Yeah. Those are fun cases.
So are you doing surgery every week?
Yes.
That's cool. So that's like, that's probably like your skydiving.
It is. Yeah. Time stops when I'm in there. I don't ever think about, I'm tired, I need to get out of here. Like, that is the one place I'm not hungry. I don't have to pee, like nothing. Like, it just all stops. And
the flow state is real. Yeah.
And then when you as soon as you scrub out, it's like whoosh, like you feel it. But yeah, it's a really cool place.
That is fascinating. It's rare that people can get in that state for that long.
I think so.
Because in that moment, there's no distractions.
Yeah.
You're cut off from the world. You're there in that moment.
And there's no windows. You don't know what the weather's like.
You're extremely present, which I think is really good for the mind.
Yeah.
So that's, yeah.
Yeah, I feel very, very blessed to have the opportunity to do what I do. And there's definitely like a disconnect, like you get in a zone and it's a person on the table, but it's also like you have to be like thinking about what you're doing. It's weird, but
has your engineering and it can't come together at all with what you do?
Absolutely.
How so?
So problem solving and thinking new ways to do things. I think initially engineering hurt me because I'm terrible at memorizing things. Like, people's names are really, really hard for me, but numbers, oddly, I remember. It's like probably not very helpful, right? But I think later in medical school, I noticed where some of the other medical students who've been just like killing it, like look at a book and like read it and memorize everything. Like, they had a little bit of a harder time when they saw something they'd never seen before. But I think that's kind of where I do better because I try to think outside the box. And I always think of engineering like a toolbox that you carry around. So you got the tools, you just figure out how to solve the problem with it. So that's kind of how I look at engineering.
So you bring that in and you're looking at, okay, how can I reconstruct this or use this? And it's all, and is that a visual process that's happening in your mind?
Visual, but also very hands-on. Like, I definitely like to touch things and, but I like to take 1 million pictures. So I have like 1 million before and after pictures. I study those. Like, that's my homework the night before surgery is I pull up the before pictures on patients and I sit there. And then this is kind of weird, but when I was an engineer in college, I used to solve problems in my head, like the night before an exam. Like, I'd fall asleep and I'd like just like and it probably took me like hours to solve like 1 + 1 because like I'm asleep, right? But that's how I would study for those tests. And before my surgeries now, I'll do the surgery about 3 or 4 times the night before in my head while I'm sleeping. Like, this is what I'm going to do. And I work through stuff. So then when I go into surgery, it's like, okay, I've already been through this. I know what the next step is. And it's more like, you know.
I love that you said that because I can correlate it back to skydiving.
Okay.
Because I run through the skydive.
Do you really?
The whole, from getting in the plane to the exit all the way up until pulling the chute multiple times. And they teach you to do that.
Okay.
So
that's really neat. I've never heard anyone else say that they like.
Yeah, you have to go through it.
That makes sense.
You're visualizing it. You're seeing it happening. You're thinking about, okay. I'm gonna exit this way. We're gonna grab hands here. We're gonna do this. Like
Do you make like a checklist too that you go through?
It's not a written checklist, but you're doing like your emergency procedures. You're doing them a couple of times. You're checking everything. Yeah. You have a buddy system that you're checking that. But if you and I, like, say you were certified and we're jumping together, and we're like, okay, I'm gonna exit the plane. There's mock-ups on the ground to where we do like what we call a dirt dive.
Okay.
So we're practicing what we're going to do. Is when we're in the air, we're gonna do it for real. And then in the plane, you're sitting there thinking about that same thing, just as you you do for surgery. So it makes sense that you do that. Do they teach you that, or is that something you?
I probably just crazy. I don't know. I just like
because it's a thing. It's
I mean, I think like that's how like I just work through stuff. Is either I go run or when I'm sleeping. I guess normal people have dreams about
well, you're
going
thinking
to
through
Italy
all the problems that could.
So I like to. I just do that, and I wake up. I'm like, okay, I got it.
I would do that before podcasts a little bit.
That's cool.
Like before we were at the other office and someone was trying to talk to me in the kitchen and then they're like, I'm like, I have a podcast today. I got it in my head. I'm just thinking through how.
That's how I do all my speaking engagements. Typically, like that I've had to do is I get it like a, sticky note and I'll write down a couple things and then you just do it because it's just more natural, I think.
It's so funny you say that because we just did an event this week at JCon Salon.
Oh, cool.
And I was speaking in front of their staff. And the night before, I thought I was going to put together this presentation, and I just couldn't get it. I just was like, no, I have to speak from the heart. It has to. I maybe just have a couple points. But the moment I try to over prepare for something like that, talking, it's like
it can kind of come. It can come across as like
well, that or I might botch it because you miss one part, and you're like, well, that's not how it was supposed to go. It just needs to flow.
Yeah.
Okay. Cool. So I'm glad we got that going on for the speaking thing. Awesome. Anything else that we should know about you that's super fun and exciting?
I have one ear that's attached and one that's unattached.
What, like the lobes?
Yeah, the lobes.
Oh.
I don't know. You just asked me.
You mean
we are really going to have to edit this podcast.
I love that.
I don't know. It was really, I was just really unprepared for that question. Just like verbal diarrhea just came right out. Yeah.
That was great. Okay. So the grand opening, Billington Plastic Surgery is open right now, folks. Where can they find you?
So we're on 66 and 10th. Our number is 727-341-0337. But you can go to Dr. Alicia Billington or Billington Plastic Surgery on Instagram, social media. We're around all of those places. There'll be lots of funny videos. I just like to keep it real. So
you are so real.
If you go on there, you're going to see some joking around, some dancing, but you also see a lot of science because like I said, I'm a huge nerd, so you'll see lots of fun facts too.
Yes. So if our amazing listeners that are still with us,
you made it to the end.
You made it to the end. You've laughed with us. You've been here this long. They should comment a word or two below to tell us that they're still here. What are they going to comment?
Hashtag Ryan Billington. Awesome. It should be more alliterative.
That's a little complicated.
Oh, or that isn't alliterative.
Maybe
I was thinking like Bogdan Billington.
Maybe it should be earlobes.
Hashtag earlobes.
I'm going to let you pick. What do you want it to be?
Hashtag Botox.
Hashtag Botox. Hashtag Botox if you're still here. Wow, this has been fun.
I'm like literally going to go get my earlobe. You've seen Dr. Rinky's around before you retire.
Hey, I need you to attach this thing. Yeah. Appreciate everyone for making it this far. Share with a friend. This is a good one. Comment, hashtag Botox. You're still here. If you need any real estate needs, find my information in the description below. Sponsored by Bogdan Homes. And I think with that, we gotta end this.
I think we
Dr. Alicia Billington, thank you so much for being here. It's been real. All right, that was good.
Oh my God, which is that?
My cheek.